Some are accusing the governor's office of, quote, dirty politics.
It stems from publicity over the suspension of an Asheville abortion clinic's license. News 13's Frank Ferboni joins us with tonight's reality check.
And Frank, our partners at Carolina Public Press obtained documents that are getting a lot of attention.
The documents share the backstory in Raleigh leading up to the suspension of Femcare's license last summer and subsequent 3-week closure. Asheville's Femcare abortion clinic was at the center of a heated debate in the General Assembly last year. Documents obtained by Carolina Public Press show the office of State Senator Warren Daniel of Morganton pressured the Department of Health and Human Services to look into Femcare. A legislative assistant writes, "I know they turned in their Medicare licensure, but is the clinic not on the to-be inspected list?" The following month, Femcare gets a surprise inspection, leading to a 3-week suspension of its license. Then, just days after the governor signs a controversial abortion bill, his office is reportedly involved in publicizing Femcare's suspension.
The case stands out because the department had suspended 2 other clinics in the state earlier in the summer, but issued no press release and done no marketing about that. In the case of Femcare, HHS really pushed the news with some help from the governor's office.
Carolina Public Press reporter John Elliston says these documents, obtained through a Freedom of Information request, support that. A DHHS spokesman sent this press release to a local reporter, giving him a heads up on the story. Femcare and its suspension captured statewide and national headlines. The tough stance was an about-face for the governor, who campaigned against tightening abortion restrictions in 2012.
We don't know for sure, but it would appear that there was some decision made in the governor's office and at DHHS to make a concerted publicity push about this suspension.
The documents drew sharp criticism from local state representative Susan Fisher. She says, "It solidifies my belief that politics were at play in the closure of Femcare." We reached out to Femcare, but a staff member said they had no comment. We contacted the governor's office for a response, but so far we have not heard back.